Strokes are the major cause of disability in this country. And, unfortunately here in Appalachia, we have such a high incidence of obesity and tobacco use and diabetes, high blood pressure. Those all are contributors. Stroke care is my passion. My certification is in vascular neurology, which is providing care to patients who've had strokes. And so I think when I came here, I just saw this need for a more coordinated, dedicated service for the stroke patients that come in from the community. My mom had a stroke when I was in college. She had what's called a subarachnoid hemorrhage, which is a specific type of stroke. But I knew at that point I wanted to go to medical school. I didn't really have a primary interest, but that definitely formed the way I looked at neurology. My grandmother was a neurosurgical nurse for many, many years. And so I just kind of grew up hearing those stories of things that happened at work. I just always had that passion. And I think the old adage is you learn neurology one stroke at a time. And that's true. It's you see the patients, you see their deficits, unfortunately, but then you can correlate that with what's going on in their brain. And it is the fastest way to learn neurology. Everybody's brain is mapped out. There's a part that affects your vision. There's a part that controls your speech, language, reading, writing, movements, coordination of movements. So when somebody has a stroke, the symptoms they're going to have are going to depend on which blood vessel was blocked. Not all strokes look the same. They can be very, very different. So knowing the anatomy and what does what helps you be able to localize, okay, this is what I think is happening and this is where I think it's happening. Now, the imaging is there to confirm that, but your true diagnosis comes from the physical exam and how the patient presents. The faster you can identify that they're coming in with a stroke, the faster you can get them treated. And time is brain, and so that early recognition becomes very important. So there's different ways we treat acute stroke. The most common thing we're going to do for people, if they're in the window for it, is going to be to start them on blood thinners, or what some people call clot busters. But secondary to that, if somebody has a large clot, we offer the service here where people like Dr. Lewis or Dr. Martin, Dr. Wynn, they can do procedures where they go up and actually remove the clot from the brain. It's called a thrombectomy, and we do a lot of thrombectomies here. But the new certification we're going for right now makes us thrombectomy certified. So it just adds another level of that higher care that people in our area will be able to take advantage of. There is definitely a huge benefit for patients to present to a center that is certified in stroke, because those centers, which we are going to provide the highest, most up-to-date care. So when a patient gets admitted with stroke at King's Daughters, we have a dedicated unit that they go to. That is where the neurologist will see the patient, the hospitalists see them, the nurses are specifically trained in post-stroke care. So it's a very good way to coordinate that a patient's getting everything they need. They're going to be seen by physical therapy, occupational therapy, speech therapy, to assess what their deficits are and what they're going to need when they get discharged. The other benefit to our stroke program is that we work very closely with cardiology and vascular as well. When somebody has a stroke, you have to figure out why did that happen to this person. And so we always do a full cardiac evaluation on patients that come in, and we always check people's carotid arteries. And if we find problems there, we have those specialists who can come in and help us manage that patient. We always just really stress time is brain. The faster you get here, the better we can provide care for you. Recognizing the signs and symptoms and recognizing that this is an emergency. This isn't something that can wait till tomorrow. This is something that needs to be addressed very quickly. We would rather them come in and it be nothing than for them to stay home overnight and wake up totally paralyzed the next day. Just remember, be fast. So B is balance. If you have any acute onset, like all of a sudden you can't walk or you're staggering when you walk, that's a concern. E is for your eyes. So if you have an abrupt onset of loss of vision, double vision, blurry, you can't focus, that would be something to be concerned about. F for face. So if you notice one side of your face is droopy or numb on one side, that should definitely get your attention. A is for your arms. Now I throw in legs too. Anytime you get weakness on one side or the other, coordination problem on one side or the other, can definitely be a stroke symptom. Speech, if your speech gets slurred, if you have problems getting your words out, if you're having problems understanding other people talking to you, or you're using words that don't make sense, those are all big red flags. And then finally, T is for time. So if any of those symptoms I just mentioned happen, getting to the hospital as fast as possible.